Welcome, friends, to the opening press conference of Asia Pacific Conference on Antimicrobial Resistance 2025, which is being held in Jakarta, Indonesia on September 12 and 13 on the theme of From Declaration to Action, Operationalizing One Health AMR Action in the Asia Pacific region. This conference is organized jointly by the Ministry of Health of Indonesian government, which is formally called Kementerian Kesehatan, and by REACT Asia Pacific. As we know, AMR is among the top 10 global health threats today. If we ensure that right diagnosis, that is early and accurate diagnosis for all diseases, is made possible in a rights-based manner for everyone, where no one is left behind, then this right diagnosis would be the pathway towards right treatment and stopping misuse and overuse of medicines. Infection prevention and control at all levels is so important, and so is multi-sectoral response. Let us first listen to a video message of Dr. Yuli Astuti Saripawan, the Director of Referral Healthcare Quality, Ministry of Health, Indonesia.
Ladies and gentlemen, the Ministry of Health is proud to support the REACT Asia Pacific Antimicrobial Conference 2025. Recognition the critical importance of addressing these growing health threats. By supporting the REACT Asia Pacific Antimicrobial Conference 2025 and the global effort to combat AMR, we aim to reduce the spread of resistant infection, promote responsible antimicrobial use, and ensure a healthier future for our nation.
Thank you. Now I would like to invite the globally acclaimed public health leader and REACT Asia Pacific Director, Dr. S.S. Lal. Over to you, sir.
Thank you, Shobha. So happy to be here in Indonesia today. We are in Jakarta as part of the Asia Pacific Regional Conference on Antimicrobial Resistance. And as we all know, this region also has high burden. This country has high burden. At the same time, Indonesia is showing a lot of political will to address this issue. And this is the second time we are having this regional meeting in Jakarta. Last time also the Deputy Health Minister inaugurated it. This time this is jointly organized by the Ministry of Health and REACT Asia Pacific. And the ministry is taking keen interest in the work. So this is an opportunity for all of us to showcase what we are doing in the region, as well as in certain countries that take up very proactive roles, and what's happening in Indonesia. Indonesia is showing, as I said, a lot of political will, and the health system is really different from many other countries. They have universal coverage of health insurance. A lot of different things are there. So health system is literally solid here, and the commitment from a person like Deputy Health Minister to address this issue, to fight this issue, and give leadership in the region is really welcome. Thank you, everyone, and looking forward to discussing this topic further and expecting your good questions. Thank you.
Thank you, Dr. Lal. I now welcome Anna Sjöblom, Director, REACT Europe. Over to you, ma'am.
Hello, good morning, everyone, and thank you so much for inviting us to join this briefing. And I'm very honored to be here in Jakarta today and together with my colleague, Dr. Lal, start the several days of meetings that we have in front of us. And thank you also so much to the Indonesian government for co-hosting this conference that we're very much looking forward to. And as had already been said, it's very encouraging to see the leadership here taken here in Indonesia on both work on the national level, but also regionally, which gives hope in this global fight that we have in front of us. And I'm a Swedish citizen. I host the React Europe node of the React network, which have also engaged in this work from several angles. And today is actually almost 1 year ago since the high-level meeting hosted during UNGA in New York on AMR, where very important and ambitious commitments were made by the world leaders. And we are very now in a crucial time to see these commitments to be translated into actions. And of course, the high-level meeting reminded the immediate action to be taken to safeguard ability to treat humans, animals, as well as to enhance food security, fosters and safeguard ability for economic development and equity, and to advance the agenda for sustainable development. So this is a major win for us, but it needs to be translated into actions. And I think we now very much looking forward to do what React is set to be done for several years, to gather actors from different parts of governments, from civil society, from youth, academia, from different sectors also, to see what can be done in this time. So thank you very much for inviting us here.
Thank you very much. And as we wait, maybe we have a few more speakers later. We can wait. We can have some questions from the audience. I have questions. Yes.
Shobha, please check if maybe Dr. Amy is here.
Okay. Is Dr. Amy there? Sorry for this. Is Dr. Amy online?
Yes, she is.
Okay. Welcome, Dr. Amy.
Okay, hello. Good afternoon, everyone. Yeah. Sorry, I'm joining.
Can I introduce you, ma'am, first?
Yeah,
we are now going to listen to Dr. Amy Rahmadanti, Team Lead, Antimicrobial Resistance, Infection Prevention and Control, Ministry of Health, Indonesian Government. Welcome, Amy.
Thank you for the introduction. Thank you for the invitation. I'm the team lead of AMR IPC in the Ministry of Health.
Dr. Amy, you are on mute, please. Can you unmute?
We cannot hear you, Dr. Amy. Please unmute yourself. Dr. Amy, are you there?
Yes, yes. Sorry, still coordinating something. So I believe our director already on the video tapping, sharing our support for the activity. I believe it already presented before. So frankly, we in the Ministry of Health, we support this activity, and we believe this become a partnership between the Ministry of Health and partner in antimicrobial resistant tackling program.
Thank you, Dr. Amy. And we can now take up questions from our participants. Please type in your questions in the chat box, or you can even raise your hand if you want to ask the question yourself. Please raise your virtual hand. We already have a few questions with us, so which were sent to us earlier. So our first question is to Dr. Lal. Dr. Lal, what is the main expected outcome of this conference? Many of our registrants wanted to know that.
Give me a second.
Yes.
Yeah, so as you know, this is the second regional conference, and this conference is specifically focusing on the region and its burden and ways to address the problems here. The expected outcomes, we would say, like strengthened regional collaboration and partnerships, consolidated regional report and actionable roadmap, regional alignment on priorities and long-term action, accelerated implementation of national action plans, civil society, youth and community engagement, and sustainable access and stewardship mechanisms. You want me to further explain it, I can do that, but these are the major areas where we are lagging behind, or there is scope for improvement.
Okay, if you could elaborate a little more, Dr. Lal, maybe that will be good.
Yeah, so the thing is, in view of the funding cutting by donors and some donor countries, we need to raise funding from countries and the region. So there are countries that can contribute to this cause in the region. And for that also, countries have to come together. Governments will be coming together through different forums, and civil society and other technical agencies have to facilitate the process or accelerate the process of regional collaboration and creating partnership. We are also, REACT is also facilitating that to establish partnerships in the region and to strengthen the existing partners. So as we know, half the population is in Asia Pacific region, half the global population is in Asia Pacific region, and half the AMR burden is also in this region. So because of that, we have to have regional action plans, consolidated region action plans. And so, of course, global scenario is there, but this region has its own unique and specific problems and issues. So we should have, while we respect the global action plans and everything, we should have tailored action plans and reports for this region. And priorities also, regional alignment on priorities and long-term action. Like I said, the health systems are different from the West or from Africa in this particular region. The private sector is huge and ever growing, and to a great extent unregulated in many countries. So priorities should be different in this region. And see, while more than 90% of the countries have action plans, some countries are yet to have to revise the action plans and to implement action plans. So many countries have national action plans on paper because of the political commitment from the higher levels of the government. But when it is implemented at national level or subnational level, we are seeing gaps in many settings and many countries. Then civil society, youth and community engagement is very important, because see, the decisions of the governments or the policies of the governments have to be translated into action. The engagement of civil society, youth and community is very important. And when it comes to access of antibiotics and proper use of antibiotics, there should be stewardship mechanisms, which has to really expand and extend into all kinds of healthcare facilities in all countries, especially major health care facilities, big hospitals and medical schools where large number of patients come and large numbers of antibiotics are prescribed every day. So there should be better stewardship mechanisms. And at the same time, we have to see that people have access to proper antibiotics. That is also important. So these are the expected outcomes. There will be discussions and there will be suggestions on these areas from the conference. Thank you.
Thank you. And we look forward to hearing those discussions online. I think it's a hybrid conference, so we will be doing that. There is a question for Dr. Amy. Dr. Amy, can you please share your plans to prevent AMR in the coming years in Indonesia? What are your specific plans for that?
Okay, thank you for the question. Actually, Indonesia, last year, we already developed a national AMR strategy, for AMR, specifically for human health for 2025 to 2029. But beside this national strategy for AMR in human health sector, we also develop the national action plan for AMR with One Health approach. So for implementation of this national strategy, we also have many government regulation. For example, the regulation from the Ministry of Health for antibiotic use, guideline for antibiotic use, guideline for antimicrobial use evaluation, and many more. Also, guideline on development of antibiogram that we think that's very important for antimicrobial stewardship. That's only some of our guideline and regulation that already developed by the Ministry of Health. Then for the implementation, we start with assessing the hospitals, because we believe the hospitals is where the antibiotics used most of the time, and there are most of the, maybe all of the reserve group antibiotics are used. So we have this assessment for the hospital's capacity from the central government hospital to the local government hospitals, then also private sector hospitals, so the private hospitals. And from this capacity assessment, we make like a mapping of their capacity, and we start to intervene their issue in each hospitals group. For example, for this year, we focus on the capacity building on Ministry of Health hospitals. So we evaluate the capacity of diagnostic, the capacity of the resource person in the hospital, their facility, their diagnostic capacity, and then we provide some capacity building, training, education, and for some sentinel hospitals, we also provide procurement of the medical diagnostic machine. And this year also we want to develop the referral diagnostic network. So we develop diagnostic referral networks between the hospital and the public health laboratory. Also, to support those activities, we also do some research related to AMR, research in the use of PCR, research in burden of diseases, research in gender equity, and research in cost-benefit analysis. And we observe that the information system is very essential in supporting the surveillance. So this year we also have collaboration with other country for development of information system for surveillance. And lastly, we built our network and partnership with other development partner and private, for example, with WHO, with Fleming Fund, with Swedia, Indonesia Sustainability Partnership, and also the REACT. And we also working together with accreditation body and corporation, hospital corporate groups for implementation of our AMR program. So for the next 5 years, we will work around that in that initiative that I mentioned. Over to you. Thank you.
Thank you. There is one more question for you, Dr. Amy. That how can the government support civil society work in the region on AMR? Do you have any suggestions for that? The question is from Andrea Caputo.
What's the question? Is it to me?
It was to Dr. Amy actually, but you can answer also. How can the government support civil society work in the region?
Yeah, so in the region, see, Indonesia is a good example. There are other countries also, like India, so who recognize civil society as a major stakeholder. So that is important. So many countries and in some settings, people think that this can be done by medical community or extended medical community, and that's all. So civil society has to be recognized. Some countries have a history. Indonesia is also in multiple infectious diseases programs. Civil society takes a major role. And here also we work closely with an organization called YOP, which is a major partner of the government. So this is what we have to do. Governments, there are examples everywhere in the region how civil society is recognized as an equal partner. So that would be my first point.
Okay. Thank you. We have a question for Anna. Anna, are there any lessons to be learned by Asia Pacific region from Europe's response to AMR and also vice versa? So maybe Dr. Lal can chip in there later on, but are there any lessons to be learned from Europe's response to AMR?
Thank you for that question. And I think it's interesting because Europe and Asia Pacific are in many aspects very different regions, but also there's some similarities in that countries that actually they're in different places in this journey in actually doing the systems changes needed. So it's very fruitful in that sense to work regionally because you can really learn from each other. In Europe, investments have been done in regulating use of antibiotics and to really work for that enforcement to happen. There's also a lot of exchanges in what should the targets be when it comes to antimicrobial use in the region. And we have a joint for the region, actually a public health agency that do country audits to countries in Europe to actually see what has been done on national level. And that is good because you can compare data and invest in joint monitoring that will help also as a group of countries to join. But I also think vice versa, it's a lot to learn also. And I think the examples actually on involving civil society is something where we can learn from your region, because in much of the work is done by, public sector and also by academia. But here, everybody knows it's also an involvement of civil society in different parts, where this be like from the environmental side to health. So I think that's some learnings of the other way around that I see. Thank you.
Thank you. Thank you.
If you want me to add something.
Yes. Yes,
Yeah,
please.
the thing is, fully agree with what Anna has told. Plus, what we have seen in bigger countries is that, see, for example, India, Indonesia, Bangladesh, these countries are bigger countries, and working at national level is important. But at the same time, we have to bring down these activities to subnational levels also, because provinces, states are very powerful, big. So working at only at national level may not achieve the results. So you have to bring this down to subnational levels or provincial levels. The other thing, briefly, Anna mentioned, governments or public sector alone cannot solve the problem. For example, most of these countries, bigger countries, high burden countries in this region, the private health sector is huge. And many countries, 70% or 80% of the healthcare is taken care of by the private sector. So if you don't engage the private health sector as partners, you will not get the results in the whole population, and you will not get the information. The surveillance will not be complete. So this is a learning from this region, especially bigger countries. Plus, engaging bigger organizations like, see, private hospitals, individually engaging private hospitals is not easy. But if you engage the medical association, or these kind of bigger players are there, so when they are convinced, they become advocates. And this we are doing in many countries, including in India, where Indian Medical Association is taking a major role, and they act as an interface between government and the civil society. Thank you.
Thank you very much, Dr. Lal. And you're right in saying that importance of subnational levels and local action to achieve global goals is so very important. Yes.
And I could just add one very short
Yes,
point too, and it's about infection prevention, that a healthy population will have fewer infections and the need of antibiotics is lesser. And that this, I think, is like, so it's a broad public health work that needs to be taken place, from vaccine programs to WASH and also IPC in hospitals, which is something I think where a lot can be done in both European region and Asia Pacific region. So just a small addition on that.
Very right. Very important addition, Anna. We have a question from Kalpana Acharya. She's a very senior journalist and a very energetic member of GAMA from Nepal. Kalpana wants to know, how can low and middle income countries strengthen surveillance and reporting of AMR cases? It's open to all the speakers. Any of the speakers can please respond to it. How can low and middle income countries strengthen surveillance and reporting of AMR?
So maybe I'll start, others can also join. The surveillance is a big problem in settings that have loose systems. For example, many countries, especially bigger countries, where private health sector is a major player, the surveillance is very random or unclear in the private sector. Patients don't know which sector is doing what. See, they take care. So because of the ease of access and other things, friendly approaches, and people tend to go to private sector in large numbers. So private sector, engaging the private sector and extending surveillance to the private sector is of huge importance, especially in these kind of countries. Maybe others can speak. I'll come back if there is requirement.
Anybody else would like to add to what Dr. Lal has said? Dr. Amy? Or Anna?
I had problem hearing the question. Was it about media's role?
No, it asks, how can low and middle income countries strengthen surveillance and reporting of AMR cases?
Okay, no, but then I think Dr. Lal gave a very good answer. Nothing to add at this point. Yeah, This is a very important part of the work, definitely.
Thank you. Thank you. Now, as we all know, the world leaders had adopted a political declaration at the UN General Assembly high-level meeting on AMR in 2024. What is your message to Asia Pacific country government leaders for the 80th UNGA which is taking place this month. So I would like each of the speakers to please respond to this. Please give your message to Asia Pacific country government leaders for the 80th UNGA. Starting with Anna, perhaps. Yes, Anna.
Was it for me to start? Sorry,
Yes,
sorry, I have problems
Yes.
hearing. Thank you. And I think for this UNGA, the focus is not so much on actually antimicrobial resistance or antibiotic resistance is elsewhere. But we think of the challenges that the world stands in front of now. And also, for example, one of the thematics of UNGA this year are non-communicable diseases. It's very, very relevant to bring in a perspective on how these diseases also going to have like patients going to be given quality care if for that, we do need effective antibiotics. So that means that we have a relevance of also talking about efficient access to sustainable access to efficient antibiotics also this year. And then I have a second mention. I think also that is about like really the work needs to be speeded up on the regional level. So go there, engage in discussions, and also make sure that come with like concrete actions on projects and interventions and initiatives that can be carried forward. Thank you very much.
Thank you very much. And I think with this, we come to the close of the press conference and wishing all strength and power to all of you for a very fruitful conference this year, and hoping to see the results and the outcomes very soon. Thank you very much, speakers, and thank you, participants.
Thank you.
For being.
Thank you very much,
Thank you
Shobha
very much.
Shukla. Thank you, Shobha Shukla, and the entire GAMA team and other journalists who joined this program. Thank you so much.
Thank you very much.
Thank you.
Thank you.